Word colic invokes fear in horse owners more than probably any other word. And when a horse colics, we're always scared that the horse won't survive. So when a horse presents with colic, what actually determines whether that horse survives or what the horse's survival rate is? A recent multi-center study set out to answer that specific question by reviewing the records of horses referred to 3 equine hospitals for colic. The researchers looked at everything from age and sex to heart rate, respiratory rate, blood work, SIRS scores, treatment type, and ultimately whether the horse survived. At first glance, several factors appeared to be associated with poor outcomes. Horses with higher heart rates, higher respiratory rates, higher SIRS scores, and horses requiring surgery all appeared to have a greater risk of dying. But when the researchers analyzed all of these variables together, 2 factors stood out above the rest. One was age, and 2 was the type of lesion. Older horses were less likely to survive. In fact, every 5-year increase in age was associated with about a 38% decrease in the odds of survival. The second factor was whether the horse had a strangulating lesion. So a strangulating lesion occurs when blood flow to part of the intestines becomes compromised. As blood supply is reduced, the intestine is deprived of oxygen and nutrients, increasing the risk of irreversible damage. Not surprisingly, horses with strangulating lesions had significantly poorer outcomes than horses with non-strangulating forms of colic. The researchers also looked closely at markers such as heart rate, respiratory rate, blood lactate, and SIRS scores. These measurements helped veterinarians understand how the horse is responding to the crisis. As circulation becomes compromised, inflammation increases, or the body begins to struggle to maintain a normal function. These values then often change. While they were not the strongest predictors in the final model, they remain valuable tools for assessing the severity of disease and monitoring a horse's progress. One area the authors discussed extensively was SIRS, or Systematic Inflammatory Response Syndrome. This occurs when inflammation is no longer confined to the intestine and begins affecting the entire body. Previous research has shown that higher SIRS scores are associated with poor outcomes, making it an important part of the clinical picture when evaluating horses with colic. So what can we take away from this study? For me, one of the most interesting findings is that despite all of our advances in diagnostics, biomarkers, and scoring systems, colic remains remarkably complex. The researchers evaluated heart rate, respiratory rate, blood work, SIRS scores, treatment type, and many other factors, yet no single number could tell the whole story. Instead, colic continues to remind us that health is rarely determined by one measurement alone. It's the interaction between the horse, the lesion, the inflammatory response, the cardiovascular system, age, and other countless factors that ultimately shape the outcome. Studies like this help veterinarians better understand those relationships and improve the way they assess risk, prioritize treatment, and guide decision making. And while no study can eliminate the uncertainty that comes with colic, each one helps us ask better questions and better understand what the horse in front of us may be experiencing.